Ladies and gentlemen. Okay, on today's video, we are trying to discuss about ulcer. Let us have an overview of what ulcer is and what it can cause to people. Okay, firstly, ulcer. We can be hearing about ulcer. At the decade now, ulcer has become a common disease. Understand? A common a diagnosis that is global now. Understand? Ulcer, when we talk about ulcer is just a sore that cause damage within the esophagus, the small intestine, and the duodenum. Understand? So how can we define an ulcer? Ulcer occur when there is a disruptive or a damage within the lining of the esophagus or small intestine, and this can be happen with the help of antibacterial called H. pylori. And when this damage of the digestive tract is being taken effective, then there is what we call acid production, because every human being that is healthy and lively has to produce some amount of significant acid in the body. When there is a damage or a disruption in the mucous lining of this digestive tract, be it the the esophagus or the small intestine, then the acid production in the body will become much, causing what we call ulcer, and is a small wound or sore within those affected parts. So one can get ulcer through antibiotics, for instance. Reason, because any drug that one takes to heal or to treat one or two diseases has a small significant damage to the system. So when we hear that someone has an ulcer, two things is involved. What is the primary cause of it? Is it through antibiotics or natural damage? If it is through antibiotics, we have a counter antibiotics that we can use in treatment of it. Understand? So, and major causes of this ulcer is, like I said before, antibiotics such as aspirin. Aspirin is a drug that many people take for, let me say, toothache issue or severe pain. That aspirin has every tendency to trigger the production of this massive acid production in the body. Thereby, if there is any damage already that is being caused by this H. pylori antibody, then it will now trigger to the development of this ulcer. Secondly, the causes of this ulcer in the system is: one, we have what we call internal bleeding or bleeding in stooling, or someone can cough and get bleeding. This is some signs, this is evidence that one has ulcer. Or secondly, you might be surprised, some people will be complaining of chest pain, back pain, waist pain, joint pain, severe joint pain, or having a heartburn. This is an effect of what we call ulcer. That is what ulcer can cause in a human body. Ulcer can cause someone to be having BP. Ulcer can cause a lot in the human body. So primarily, this has to be tackled very well within our own contemporary life, so that people can know how to manage it with life. Some people are endowed with it but not knowing that they have it. But it is now left for we individual to monitor ourselves, to know, or even go to lab. Lab is the best answer to know whether you have ulcer or not. Though we may be having the symptoms, the sign and symptoms that are relating to it, such as heartburn. When someone is stooling, the person will be finding some blood associated with the stooling. So, but the best practice for you to diagnose ulcer is for you to go to lab. Then, when you move to lab, we have what we call H. pylori test and FOB. FOB means fecal occult blood test. Fecal occult blood test is a test that is being done with stool to detect the minute quantity of that ulcer in the stool. While H. pylori test is to know if individual is being endowed with the antibody or bacteria called H. pylori. Understand? This is the two tests that will give you a clear view whether one is having ulcer or not. Reasons that some people might go to hospital, they want to do an ulcer test. Understand? So primarily they will only try to confirm whether they have ulcer using the blood, which is H. pylori. Funny enough, they might not see the antigen, the antibody that is the H. pylori that is the main causative organism for it. But going back the other way around, using stool to do the test, the person might be endowed with it, and the person will be acting how. The reason is that maybe the H. pylori has not finished the effect of damaging the lining mucus of the stomach or the esophagus. But from the stool, you can able to see it because the stool can detect any minute part of that ulceration. So, my dear brothers and sisters, this is a very common disease that can kill. Many people will having this ulcer, but they will feel adamant or feeling reluctant to it. It can cause a serious internal bleeding for somebody, thereby destroying the intestine of a human being. The person will go to hospital, they will say it's an ulcer, and it will lead to an operation to cause some of the damage, already damaged intestine. So, my brothers and sisters, in this contemporary world, in this modern age, in this 21st century that this word called an ulcer is a small thing, but it causes a lot in human being. It can also cause a perforation within the livers or intestine, having the person endowed, leaving the person to be endowed with what we call liver cirrhosis on the other things or the other. Understand? So we have to take what we take serious to avoid this. Number one, we have to avoid starvation. Whenever you notice that you are hungry, try to find something and eat to quench that hunger. Even if you don't have anything to eat that particular moment, try to take enough water. Enough water. It will go a long way to help. Secondly, we have to avoid all these beverages that has excess gas like alcohol. Avoid too much taking of alcohol, because if an individual is already endowed naturally with massive production of this stomach acid, and we are now overlaboring the stomach with the level, with the some stipulated amount of acid that it has to create, with additional one that you are taking in, you are now seeing that you are the one causing yourself more harm than good. Secondly, we have to minimize the intake of antibiotics. different antibiotics at a time, all in the name of treating one illness or the other. We advise people that if you take prolonged take of antibiotics can lead to this ulcer. So we advise people that we have to minimize the way we take antibiotics. There are some people that try to take antibiotics, self-medication, then abusing drug in one way or the other. Maybe the person is seeing one sign and symptom, the person will just rush to one pharmacy or patent dealer shop to buy the highest antibiotics, not knowing the antibiotics is causing more harm than good to the system. The person being so ignorant, the antibiotics will not even work in what he or she has bought the drug for, thereby causing more damage to the body than good. So my dear brothers and sisters, we have to take what we have to take a good recognize of what we eat, how we carry ourselves, what we drink, to avoid we having this serious illness, because it's a very very serious illness, but some people do neglect it and it can kill. It's what we call silent killer. Somebody will be passing away why you not know that the person is dying as a result of this ulcer. Okay, you find out that some people will be coughing out blood sometimes. They'll say that somebody has eaten poison. They will be carrying the person to one native doctor, herbalist or the other, not knowing it's just something that the person might either cause by himself or through drug, without going lab to confirm primarily what the cause is. And the person will be carrying to one native doctor or the other, all they know that the person has eaten poison or not. They'll be giving you all sort of concussion, thereby killing you more and damaging the liver and other organs of the body. And know it fully well that once the liver is damaged in a human being, the person is gone. The liver is one of the most essential organ in the body that has to be very, very preserved. Sorry, we are digressing a bit, but we are trying to tell people what ulcer can cause in human being. Like I said, liver is a very, very important organ in a human system that has to be preserved with utmost care. Thereby, we have to be so mindset of how we take things, what we consumed. Understand? So all these herbal medicine do damage liver very fast than medical treatment and drug, because in terms of medical, there is a state that someone will reach, they will refer the person to a lab in order to checkmate or ascertain or to check how the liver of the person is. But using orthodox drugs and medication like this, one cannot know that. With the physical signs and symptoms that you can see in a human body, they can say, okay, go to lab and go and do what we call liver function test to check the whole parameters to know whether it is good or bad. This is what all these concussion called native drugs can cause to human being. Not knowing is just an ulcer that is triggering all this thing. So we have to manage ourselves. For the treatment of ulcer, medically, ulcer can be managed with some certain drugs. We can manage it with some antacid suspension, being it capsule, being it tablet. In suspension, we have this different type of antacid suspension. We have what we call stop acid. We have what we call gestid. We have what we call gascool. We have different antacid suspension. What are the works of all these antacid suspension? The work is for it to suppress the acid production of the stomach. Coming to the capsule part of it, we have what we call omeprazole in different forms. It can also help in the treatment of this ulcer. Understand? And most importantly, we have to control this through natural means. We have to eat healthy food and also try to avoid things that can trigger it, like excessive alcohol. Smoking can lead to ulceration. Excess smoking can lead to ulceration because one, you are burning the intestinal tract, trying to cause more harm than good. Thank you for this little.
Thank you for this information, for this wonderful information you just passed. But the question, like from experience, I have had on this because I was once an ulcer patient. So, but I noticed that it can sometimes drinking of warm water or hot water, I think, is a source of controlling it, and avoiding drinking cold drink, like something that is too chilled. Because I could remember there was a time, anytime I drink any drink that is too cold, then I will experiencing a heartburn. But each time I'm feeling pain in my heart or in my stomach, once I drink hot water, it will reduce a little bit.
Okay.
So the question, because it's something that I experience within my body. So is it like is drinking hot water and reducing something that is and reducing drinking something that is too cold? Is it a measure of controlling it?
Well, this can be a measure for individual, but this cannot be a measure for another individual. All this depends on what works for someone. Understand? So, like what I know is that milk has to reduce the to calm down the ulceration pains and the acid reflux production in one. We advise some people that whenever you notice that you're having this chest pain or stomach pain related to this ulcer, you can go and get milk and take, or all this aquarafa you got. Then you can,
Yogurt.
yes, aquarafa you got. Then you can now see for medical expert. And we have also to, you can manage it or control it through your diet, like I said. Some people that takes egusi soup, there are some people that might take egusi soup, it will become problem for them. This garri can also cause it in one person, and it might not be an issue in another person. So the general thing that we have to do is that we have to monitor ourselves as an individual to know what really trigger it or what affects if one is endowed with this disease called ulcer. But for you to know if you are endowed with it, you have to go to the lab. Is a medical lab scientist or technician will now conduct a test using your stool and your blood. After the test, the person will satisfy whether the ulcer is there or not. Then it is now less for you as an individual to monitor yourself or how to control or to avoid steady reoccurrence of this uh, disease called ulcer.
Thank you for this vital information. Please, I would like you to press like and subscribe button. It will help in the YouTube algorithm. Thanks for watching.
Thank you.